community. Oh, this meeting's being recorded. There we go. So let's all behave. Welcome to the Community Forum, October 2021. Unfortunately, here we are back on the Zoom platform, but we're all experts at this now, so there won't be any IT issues and it'll all go lovely and smooth and we'll have a lovely afternoon. But let's hope, actually saying that maybe next time we can do a face-to-face. So for those who don't know me, my name is Martin Ballard. I'm a GP in Farnham. I've been there for 20 years now. There I am there. The only difference this year is that I now have reading glasses. So gosh, you know, another year older, I now have to wear reading glasses, but it comes to us all, I'm sure. So that's me. We've also got Kathy Atkinson, who I'm sure most people know. There she is waving away. And two new faces to the Community Forum. We've got Dr. Gareth Robinson. Now, Gareth is a GP in Yateley, and he's been a very valued member of the system here at Frimley for many years. As some of you will know, Stephen Clark has stepped down for his role as place-based clinical lead, and we're delighted to welcome Gareth, who started very recently, the last couple of weeks, and this is his first Community Forum. So welcome to Gareth, and you'll be hearing from him very shortly. Lauren Pennington. Now, Daryl Gasson usually takes this slot, but unfortunately Daryl had to go to an emergency meeting this afternoon. So Lauren is his much more glamorous replacement. So welcome, Lauren. Lauren is the Associate Director of Primary Care and Primary Care Network Development within North East Hampshire and Farnham, with a wealth of experience. And Lauren is going to be talking through one of the items on the agenda this afternoon. So a bit of housekeeping, same as always. Hopefully you're all familiar with the Zoom platform now. So you can, I think top right hand corner is your way to look at who's speaking, whether you have an overall view or you have an image of the speaker, which in this case obviously would be me. So keep your camera on, please, but do please keep your microphone muted. It's always great if we can see you. It makes it a lot more interactive for us. So please keep your camera on, unless of course you are perhaps eating or picking your nose or doing whatever those things you don't want to be shared with. Do please keep your microphone muted to avoid any background noise. Thank you. So there is a chat function on Zoom, and we always value your input, any comments, any questions. Some of those we will try and answer as we go through, but there may be some that would be more appropriate at the end of the session, and I will host a Q&A at the end of the session. So if it looks like your question's been missed, it probably hasn't. We're just grouping it together, and hopefully we will address it at the end of the session. But please do put your comments in there. We find them really helpful, really valuable. So please do interact as best you can. And we know, of course, the session is being recorded. So let's all behave. Right, agenda, here we go. So we've got a few things, a few hot topics at the moment. We're going to be kicking off, obviously, with a little bit about the Frimley Health and Care Integrated Care System update. We had a little bit about this last time about the boundary changes potential, and we've got a few little updates for you on that. Something about the healthier communities, and something that's obviously in the paper at the moment, very hot and topical demand across the NHS, in particular primary care. And then a little bit about where we are with our COVID-19 vaccinations, the booster programme, and the flu uptake. And there will be, obviously, as I say, plenty of time at the end, hopefully, to answer some questions. And it is worth noting that we're going to keep this forum platform open after the meeting for sort of 10-15 minutes. So if there's anybody who wants to hang around at the end, we will be here for any sort of offline conversations. So please do hang around if you want to have a chat with us. Okay, so I'm going to kick off with Lauren. So Lauren is going to introduce herself and take us through the first agenda item. Lauren.
Thank you, Martin. And just as you said that, this beautiful ray of sunshine blinded me. So let me just try and sort that one out. There you go, the joys of home working. We've also got a very naughty and hungry cat walking around. So if you see me wince or move, it's because I've just had my ankle bitten. So I'll see how far I can get without her destroying everything. So last time we met as a community forum, we talked to you about some of the changes that the government had announced in how health and care was going to work in the future. And for us here in North East Farnham, that presented the potential for quite a change in how we worked as healthcare commissioners. So there was a lot of conversation and a lot of feedback, and an opportunity for us to share up the chain how we felt as a system and how we wanted to work in the future. As a result of all of those conversations, there was a decision made in July that meant that Frimley could stay as it was with the current boundaries that we work to in place. So that means that moving forward, we can move and become an integrated care system as planned from April 2022, which for many of us working in this system is something we really wanted to see achieved. So that was great news for all of us. The first step in becoming that integrated care system is to ensure that we've got a chair, and we're very pleased to confirm that we have been able to appoint a chair designate, Dr. Singh, and we've provided some more information about her background and the experience that she brings in the press releases last week. But one thing that we did hear from you very strongly last time was about some of the complications that those boundaries create for patients living in North East Farnham. And we know that we've worked well with our local partners over many years, but there's always an opportunity to do things better. So with this announcement that our geography remains the same, one of our most important priorities and things that we'll really be focusing on is how to continue to strengthen those relationships across the boundaries so that no patient gets caught in the middle and faces unacceptable challenges in accessing care simply because of where they live and where we as commissioners put our boundaries. So we know that's something that you feel really strongly about, and that's something that we're really committed to doing. So one of the good examples of how working with partners is really helping is around some of the premises projects that we're really excited about. And we just wanted to share updates on 4 of those with you today. So the first one is all around Aldershot Centre for Health and Farnham Centre for Health. And at the moment, we've got a lot of what we describe as void space. So what that means is empty space or poorly used space. And these are great buildings. They're in the hub of the community. They've got loads of services in them. So it's a real missed opportunity if they're not full and thriving. So we're in the middle of a plan at the moment to try and make the best use of all of those rooms and to really maximise the estate that we've got available. So there are ideas to expand and move in some really valuable services for our local community. For example, in Aldershot, the midwives are currently spread over multiple rooms and multiple buildings, and mums report that it's really difficult to get to those clinics and commit to the care that the midwives can provide. And also many are not able to travel to Frimley Hospital. They need something local in their community. So there's a lovely area in Aldershot Centre for Health that we'll be making available for the midwives. Its own discrete area with its own entrance, waiting room, space for education, right near the coffee machine, which is very important, I hear, for all young mums. So that will be a fantastic improvement for the building. We're also planning on moving in some mental health services who've been struggling to find a place from which to provide clinics. And also there is a desire from Frimley Park to bring over and increase their ophthalmology clinics. So there's a big area in Aldershot Centre for Health that's completely undeveloped. So this will become a big diagnostic suite for them. Over in Farnham Centre for Health, where the vaccination clinic is currently running, there's a plan to try and improve that and to move in lots of therapies. So that includes people like physiotherapy and occupational health, all of the things that people have to currently travel quite far for, but once people have had their operations, it'll be much easier and more convenient for them to come to Farnham Centre for Health for their care instead. There's also plans now to look at Frimley Park Hospital as a site and to see how that needs to change and improve and have some construction to make it fit for the future. One of our practices in Farnborough, Gifford Drive Surgery, and they had their planning permission for an extension agreed quite some time ago now, And it's been a complicated build and very challenging financially, but we're pleased to see that there's some good progress with this, and we're confident that the build can still go ahead. And then the final one, as pictured here, is the Farnborough Civic Quarter regeneration. So there's been a public consultation recently about the plans that Rushmore Borough Council have designed for this regeneration. And it was great to see so many local people involved in those plans. Thank you to everyone that participated in that, because what came out really strongly was the need to improve health facilities in Farnborough. And as a result of that, we're moving forward with the council to find the best space within this regeneration to house a GP practice and complementary health services. So lots more information to come on all of those projects, but those are 4 big things that we're working on at the moment that we wanted to share today. Hand back to you, Martin.
Great, thank you very much, Lauren. Yeah, I just sat here listening to all those projects and thinking, you know, we would never have been having these conversations, you know, 10 or even 5 years ago. And it just shows how far we've come now with strengthening the partnerships with all the community services and all the different stakeholders within the system. And, you know, sometimes you have to just keep a check that you don't take it for granted and you keep striving for better and better. And I think where we are now with the boundary being defined and secured, that actually it gives an incentive to ensure that we do keep strengthening and keep driving forward with the right people at the right place. And those projects there demonstrate actually what can really be done, and it's fantastic. Yeah, great. Okay, thank you, Lauren. So Kathy, over to you. So here we go, Kathy.
Hello, hi, hello everybody, good afternoon. I'm Kathy Atkinson. I'm a lay member on the, well, what we used to call the governing body. I think we're now called the Board of Frimley Clinical Commissioning Group. And I'm just going to talk a little bit about some of the sort of community engagement work that we've been up to and that we're planning. I don't have a hungry cat in my house, but I do have 2 hungry teenagers. If they start biting my ankles, we're in big trouble. So you'll probably know about it. I've just got a couple of slides, the first, and a couple of videos actually that we wanted to show you. But the first really just tries to set out the sort of overriding ambitions for Frimley Integrated Care Partnership, what will become Frimley Integrated Care Board when it passes through Parliament. And this has been developed actually a little bit of time ago, probably a year or so ago. No, so 2 years ago. There we go. Gosh, time flies. And I guess one of the things I wanted to point out on this slide really is the sort of vision to try and address, maybe not resolve, but certainly address some of the health inequalities that we know are experienced. So the different experiences of health and care that people in different parts of the community face. And that really underpins this vision. And we know that quite a lot of those, the drivers of those inequalities are actually really not necessarily things that the NHS can address. They might be around housing or employment, education, etc. So that's, I suppose, underpins the need to continue to work in partnership, not just with other health organisations, but particularly with our local authorities right across the area. Could I have the next slide, please, Steve? Thank you. And then just wanted to pull out a couple of things. Those of you who came along to the annual general meeting a couple of weeks ago will have seen some of this before, but the community deal is one of those little branches of the rainbow that you just saw. And really that's our ambition, to continue to build on what we've been doing in North East Lancs and Farnham for a long time, which is to really try and make sure that we work with local residents, because we are firmly of the view that people are the experts on their own health, and that people have loads of great ideas and innovations to try and help create a healthy community for all of us. And that if we can just work with the local communities, then hopefully we can unleash some of those ideas and create some really good solutions. So we can certainly want to continue working in that way as the sort of structures around the NHS evolve. Many of you will know about the Innovation Fund. We've been running that for several years now, and it was bigger and better this year. we were able to support more projects across a wider area with more funding. So it's been a real success story, and we'll have a look at a couple of those in a minute. The other thing I just wanted to pull out here is a new digital interface that we've set up. It's the Insight and Involvement portal. So this will be a web-based system where we are going to use it for all sorts of things. I should say it's only one way that we're going to keep the conversation going between the CCG and local residents, but it's a really valuable new way that we can run surveys, we can ask for your opinions and views on ideas and issues and proposals that might be around. So at the moment, I know there's a survey on the portal around digital access. So it's definitely somewhere to go and have a browse, have a look at the information there, and there'll be loads of different ways that you can get involved. And we'll be developing that portal as the months pass. So I just wanted to introduce two short videos, and the first actually is going to be introduced by Anusha Gurung, who is from the Rushmore Citizens Advice Bureau, and she's going to tell us a little bit about a special video that they've prepared for the local community there. Anusha, you there? Oh, hello.
Yeah, hi, I'm here. So do you want me to share the video here?
Just tell us a little bit about, tell us a little bit about the video, and then Steve will play it.
Oh yeah, great. So basically, so we got the funding from the Innovation Conference project to work on this video. Basically, I used to work on the Nepali helpline at Citizens Advice Rushmore. So while I was delivering this service to a Nepali community last year during the pandemic, like during the lockdown time, so we realized that that there is a gap in terms of there is a service provided in a Nepali Nepali interpreter services provided there, but however they are unable to access those services. So not just like limiting to a Nepali community or a Nepali interpreter, but I think the other language interpreter services as well, they are not able to access despite it's there. So for example, so I try to help one of our clients to call NHS 111, but there was a lot of options given, like you have to press option 1, you have to press option 2 in order to get hold of a person on the line, you know. And the person who I was helping, she had a language barrier, digital barriers. There was no one to help her on her house, and it was a lockdown time, so she was not able to go out and ask for the help as well, you know. So that's how she came to us via phone. And so it was, I personally struggled a lot to get a hold of someone on the line that can help her out in a Nepali language. So yeah, so from that incident, from that particular specific client, we came up with this idea, maybe if we create the video that shows step by step what option to choose in order to get a help from someone on the phone, you know. So that's the overall idea to come up with this this video. But however, I had this conversation with Kelly as well other day. So however, this is just a temporary solution, you know. So I think like there should be something need to be done in order to solve this problem. For example, I also suggested that maybe having a standard number for interpreter line, you know, so that they don't have to go through these options to press in this and that, because they will not understand that. So yeah, that's the overall idea. I don't know if I managed to give a proper the description or information.
Thank you. No, Anusha, yeah. That's great. Thank you. And I think Steve's going to play a little bit of the video so we can hopefully all learn some Nepali as well.
Yeah, there is a subtitle as well.
Namaste. आज म NHS 111 फोनबारे जानकारी दिलाउँदैछु। यदि तपाईलाई सन्चो भएन र आपत्तिजनक अवस्था छैन, जस्तै छाती दुख्नु, वा सास फेर्न गाह्रो हुनु भने तपाईले आफ्नो जीपी सर्जरीमा फोन गरेर सम्पर्क गर्नुपर्ने हुन्छ। तर यदि तपाईको जीपी खुल्ला छैन वा तपाईको जीपी नै छैन भने तब तपाईले 111 मा फोन गरेर सम्पर्क गर्नुपर्ने हुन्छ। आपत्तिजनक अवस्थामा चाहिँ तपाईले तुरुन्त 999 मा फोन गर्नुपर्छ। यो सेवा 7 दिन 24 घण्टासम्म उपलब्ध छ र यहाँ तपाईले नेपाली भाषामा पनि सेवा पाउन सक्नुहुन्छ। तपाईको फोनमा यो फोनको चिन्हमा जानु र 111 मा थिचेर कल बटन दबाउनु। यो कल अगाडि बढाउनको लागि 9 मा थिच्नुहोस्। NHS 111 services are currently extremely busy, and we are unable to answer calls as quickly as we would like to. If you are able, you may find it quicker to use 111 online, accessible at 111.nhs.uk. If you feel that you are safely able to look after yourself without speaking to someone, then guidance on self-treatment is available at www.nhs.uk. You can also get advice at your local pharmacy or GP when open. If you're calling about coronavirus testing or the COVID-19 vaccination, please hang up and go online at nhs.uk/coronavirus or call 119. Press 1 to get this link in a text or press 2 to continue. यदि तपाईको समस्या कोरोना भाइरस जाँच या कोरोना भाइरस खोप सम्बन्धी हो भने यो कल यही अन्त गर्नुहोस्। तपाईले 119 मा फोन गर्नुपर्ने हुन्छ। यो कल अगाडि बढाउनको लागि 2
Fantastic, thanks Anusha, and that just gives you a flavour for what was produced there, which is really brilliant initiative in terms of a different type of communication for specific specific members of the community. So congratulations on doing that, it's really great. We've got one more short video now, which is really to pick up a couple of the other projects that were supported through the Innovation Fund, which sort of gives you some illustration of what we mean when we're talking about this idea of the community deal. So again, Steve is going to set up the video for that, but I hope this will give you a good flavour.
The community deal is very much a key ambition within the Frimley Integrated Care System strategy. It's very much an enabler. The individual people in individual communities have a much better understanding of what works for them and their communities than probably we do as organisations.
This ongoing dialogue between ourselves and those we serve. And you have to give help and support to people in a way that they feel they can access, that they can use. We don't have all the answers, and very often our communities do.
We're standing on the site of what will be our new community garden in Fleet.
I think people have had a lot of restrictions placed on them in the last 18 months, lost control over their lives a bit. And I think this is going to really build people's resilience back up and keep them fit and healthy and happy and make new friends.
We're really bringing together a whole variety of people from across our district where they can share their experiences, they can socialise, they really get an opportunity to get out, and that's so important for community spirit, health and well-being, socialising. It's really important to us that we create a place that people value and love and want to come out and use.
In my role, our main aim is to build partnerships to ensure that places like the Heart Green Garden can be established. It requires a lot of partnership working, collaborative working, and I'm delighted to see that that collaborative working has brought together everybody, and in the next couple of months we'll be able to start bringing it to life.
Working alongside Men's Shed particularly, they have been so supportive. They've built us some really great things for the site, saved us lots of money.
It was just natural, just felt right that when they told us about the community garden, was there anything we could do to help, that we said, yes, of course.
At the end of the day, the community is key to everything, and for the NHS to recognise that is a real bonus.
Support from the NHS in helping to establish community gardens, men's sheds, and enabling us to run and provide that support is just so important.
When the pandemic started, a lot of the services, they moved online, or a lot of the support groups that was run locally, they moved online. And so our elderly Nepali people, they were struggling to, let's say, book appointment with the GPs or accessing any of the support system that is available.
So it's sort of like reducing the social isolation, but also it's like digitally making them competent, giving that sort of skills.
Many of these people live in a HMO as well, housing in multiple occupations, and pre-pandemic they used to come out in the park like this and mingle with other people. When they were by themselves in those rooms, they had no phone, they had no television. That obviously really impacted their mental well-being as well.
We have been delivering online sessions via Zoom. We do sessions once in a week.
There is a gap between the community and the service provider, and I think projects like us, projects that are led by people who are in the community, helps to bridge that gap. Because you guys have given us this funding, you guys have really encouraged us to do more in the community, and we are able to connect with lots of young people and other organizations, and that has given us lots of confidence.
We have seen what is the demand and what needs to be done. So when you listen to us, then we get more done. We get to help more people. I think that's the one message.
Seeing the work that both individual residents and communities are doing is really absolutely awe-inspiring, and it's what keeps me going.
The one message I would give to communities is you can and you are able, and we are listening, and we can support you, sometimes with funding, to achieve your visions and your ambition. So come on board, work with us. The door is open, and we want to hear what you have to say.
Thanks ever so much. Thanks for the video. I don't know if you could see the writing for me at the end was a little bit fuzzy, but if you go to the CCG website, you should be able to see some more information on some of the other projects, and you can see the video. Oh, brilliant. There we go. Fantastic. Thanks, Steve. So that's the website if you want to have a look at some of those. Gosh, that garden project, this looks pretty daunting. I only have a really, really small garden and I'm unable to keep it in any sort of decent state, but having that big brown field as a starting point is quite a project. It'd be really exciting to see how that evolves. So well done to all of the projects that are getting funding from the Innovation Fund this year. And I think one of the things I always think when we see the Innovation Fund and the innovation projects is really the variety of ideas that people have got and the fantastic ideas that people have got. And again, how sort of far away from the kind of medical model, the medical solutions these are. They're really about health and well-being in its broadest sense. So it's really inspiring. I think that's all from me. I've done a little plug on the portal. So again, I think the link is in the chat as well, so you can have a play around and have a look at the new portal. And I'm going to hand back to Martin.
Right, thank you very much, Kathy. So yeah, I echo what you're saying about the Innovation Fund. I've been involved with it for a few years, and for me, it's always asking for a strap line, small amount of money with huge impact, because I'm always amazed actually at the impact it has from just a very small bit of investment. And I remember when the first one we did, I think we had to choose a ping pong ball to put into the one we wanted to vote to receive the sort of small amount of money, and it was just so hard to choose because they're all so good. So I'm always amazed at the projects that are presented. Is excellent, and I fully support that. Particularly well done, Anusha, for the 111 video. Really, really good. We know that it is often difficult for people whose English is not their first language to access health services. So I think anything we can do to encourage that is always welcome. So thank you for that. Really, really good. Right, Gareth, over to you for your first piece at the Community Forum. Welcome, and if you want to take the floor from here, that'd be great.
Very kind. So my name's Gareth Robinson. I've been a GP in Yateley for 24 years, doing this job of clinical lead of North East Hampshire and Farnham for my 3rd week. So this is a nice little baptism into how things go. Probably relevant to what I'm going to be talking about is I'm also in charge of the vaccination centre in Yateley for both COVID and flu vaccination. So I'll crack on with it. From the point of view of this winter, I think everyone's very aware from the media, from everything that you see being bombarded, newspapers and television, that the demand across the NHS is something that is currently much higher than it is usually. There's really a concern about what this winter is going to be like. So we've all been making plans, trying to make sure everything happens in exactly the way that it should, to make sure care continues to be available to patients. There are large pressures anticipated on the front door of hospitals and accident emergency departments. Clearly for us, there is a large pressure about how it's going to continue for general practice and our community services colleagues as we try and keep people out of hospitals, try and keep care to people close to home as possible. You may well be aware that demand in the NHS has been at a high level now for a good 18, 19 months. Everyone has tried their best to keep services going. At times we've had to prioritise certain things. Obviously, coronavirus, COVID action has been necessary. Particularly relevant for us is that winter last year was a little bit strange. We had coronavirus, but we didn't really have the normal wave of viruses that we see both in children and adults. So bizarrely this summer, we started to see the winter illnesses in children. And there's obviously a large concern about what would happen if people have flu and coronavirus at the same time. So we're really looking at making sure we get immunisations, which I'll come to later. As I said, we've had to prioritise certain things during the pandemic, particularly care of people with coronavirus, and that has had a knock-on effect at delaying some of perhaps what are considered the more routine things that we do. In primary care, that might be the management of patients with chronic diseases. For people who have been referred to hospital, that can easily mean a delay in outpatient appointments. It can certainly mean a delay in operations happening. And there really has been a lot of investment planned about how we're going to address that, how we're going to make sure the workforce is there, how we're going to make sure that operating theatres are available. And there has been investment both in primary care and secondary care to try and make sure that services can somehow eventually get back to normal so that everybody has what they need. Throughout the pandemic, I think everyone has to be honest, has worked really hard. Primary care has been open, hospitals have been open. There's lots of confused media messages sometimes about what's really going on, but people really are working the hardest they possibly can to make sure that face-to-face appointments happen, that people can access primary care for both what they need and what they want, trying to make sure all elements of the population can get the services that they require. And in doing that, I think staff are really tired. I'm sure you might well have tried to contact your practice and found difficulties in doing it. But within that, the poor staff are working really hard, running around, trying to get everything done. And please, where possible, keep the idea of being nice to them. They are trying their hardest to do what they need to keep people well. Very sadly, we are starting to see abuse happen. We're starting to see people who are just trying to get on with their jobs, doing the best that they can, being shouted at really quite unpleasantly, and anything you can do message-wise to people that you know to try and make sure that everyone's aware that people are trying really hard, just work with them, would be really appreciated. I can have the next slide. So even before the pandemic, there was a lot going on about trying to revolutionise the NHS, trying to look at how we do things differently. There had been plans to bring in video consultation, plans to bring in e-consults, but probably overnight on the 23rd of March last year, everything happened, and GP surgeries, community services had to start flipping what they did to a very new model of care, so that we could try and stay open, try and deliver services to patients, try and make sure that what we did was safe. And throughout all of this, we've been trying to develop integrated care. You may have heard of things called primary care networks, in which each local area now, surgeries are working together more closely. And along with that has come some investment where, because there aren't a tree you can pluck GPs and nurses from to try and do all the work that is required, trying to expand our workforce with additional roles has again attracted some investment, and we're now working with paramedic practitioners, helping people have home visits, physiotherapists offering musculoskeletal condition advice, mental health practitioners, basically trying to work with teams of people. And within that, that can sometimes mean that traditionally it might have been perceived that a GP was the person that you needed to see. Thankfully now that workforce being expanded really does mean that there's a team of people. And that is very much why receptionists will commonly now ask people just a little bit of information about what it is that they're needing, what they're phoning about, so they can try and direct people to see the person who is most appropriate to actually manage the condition. And of course, if we can all do that, then we can get more people seen. Again, we can try and get back to normal a little bit faster. Next, please, Steve. So, I mean, one of the things that we really have to do is use the health service efficiently. A lot of work has been done locally about trying to help people understand what service to use in different conditions. You've obviously seen just there about how particularly a part of the population that finds it difficult to access service, work has been done to try and help them understand who to contact and when and how to do it. We're trying very much to, again, in line with the idea of having people see the most appropriate person. If people have minor injuries, they can contact 111. They can have appointments booked directly with minor injuries units or A&E if that's appropriate, so that services can function more efficiently. We have to protect 999 for the real emergencies. I think everyone will have heard that there are increasing waits for ambulances, and anything that can happen that makes the resource of ambulances available for the people that most need it has to be appreciated. We've been working very much with local populations about accessing care, and sometimes how to help people look after themselves. There is an app that's been developed, information that's been developed, I believe the links will be being shared, about being healthier together. And within this, it's aiming to help parents of young children understand sometimes what symptoms are bad, what symptoms are okay, and you can allow perhaps paracetamol to be given and observe later, but then what to watch out for. And if things are going wrong, what would those things be? How might you then access the care that you need the best way? And as a consequence, sometimes emergency departments may be the right answer, sometimes it's GPs, but we're hoping to get the information out there to help people understand how to use the service better. Next. So along that, helping people to stay well, I think a lot of what has been missing from health over a long period of time is, well, we do illness, but actually we need to work about how do we keep people looking after themselves. I think what we've really seen over the pandemic is the mental health effects on well-being across all populations. and booklet again will be shared to try and help people just do the right thing, look after themselves, make sure that they're as fit as they can and should be. Which brings us to kind of my favourite subject, COVID vaccination and flu vaccination. As I said, because last year we didn't really have winter as we understood it normally, because people kept themselves very much to themselves, away from other people, a lot of the colds, a lot of the flu viruses didn't circulate. The consequence of this bit has been the way the immune system works is you kind of have to keep challenging it a little bit to keep it doing things. And where people haven't had flu and had colds, we're anticipating perhaps that this coming winter, things may be a little bit more challenging, and it's so important therefore to get flu jabs done. We know very sadly that if people have COVID and flu at the same time, they may well suffer a little bit worse. You may well have had invites from your surgery about getting flu vaccinations and COVID vaccinations done together. Clearly, it's another bit of work to bring in another immunisation, get them done at the same time, can really help allow services to move along. And we know, sadly, very locally, Hampshire-wise, that the national average for COVID infections has been going up, but Hampshire's actually a little bit worse. So we're starting to have to be vigilant again, and one of the local GPs you may have seen on the television last night talking about how we need to start thinking about space again, how we need to just kind of make sure we all keep ourselves at best chance of not catching coronavirus. Along with that is the COVID booster. So I think next slide, please. So you may well have had an invite to have a COVID vaccination booster. They're to be done 6 months after people had their second vaccination, which for many people over the age of 50 has either happened or is happening at this very moment. They're eligible to anybody who's over 50 or in at-risk groups. Very similar idea to people being offered flu jabs. So important to have them. We know, sadly, that the vaccinations have been fantastic, but with time, the effect goes down a little bit, and the boosters are going to really help keep people's vaccination levels up as far as possible and reduce the risk of severe illness should COVID happen, if indeed it didn't stop it. And I'll stop there. Thank you.
Great. Okay. Thank you very much, Gareth. Right, so I know that we've been answering questions, most of them, as we've gone along. I just wanted to reflect a little bit on what Gareth was saying, and actually just to sort of, reinforce the point about demand. And actually, I don't think there's a single GP colleague who can say that he or she is not working the hardest he or she has ever worked in trying to catch up with the backlog of what we've been left with following the pandemic, and that is juggling what patients require, what patients need, and through a different various sorts of consultations, whether it's telephone, face-to-face, e-consult. I mean, the list goes on and on and on. And it's a huge juggling act, and we, I think Gareth summed it up. We are doing our very best, and I think the guys on the front line, the reception staff, are feeling the heat, and I think that's something that we have to look to protect, because they are a pivotal part of the service, and I think we forget that. So thank you, Gareth, for making those points. It's time for questions now. I say most of them I think we've sort of touched on throughout there. I've just got a few just to mention. And the first one, actually, I'm going to answer myself, actually. And Peter Callum asked this about, is the panel happy that receptionists are adequately qualified to be gatekeepers? Really good question. Rewind 10, 15 years, I'd probably say no. We have had a huge amount of investment and training in our front line staff, and this really was actually an NHS England's initiative some while ago, and the idea is really to make sure that the patient sees the right person at the right time. And we know now that a GP is often not the right person. There are often people who can do it better than us GPs, and we have to recognize that. And it does take a lot of training. And I'm in the fortunate position that I do play a role in the Frimley Training Hub, which offers training to reception staff in order for them to be confident in navigating and directing the patient to the right place. Now, there will always be an error potential with that, but on the whole, training receptionist has gone very well, and we are confident as GPs. Actually, they do play a very important role, and we do trust them. And they follow and adhere to a strict training program and guidelines on, for example, if someone phones up with chest pain, they know exactly the questions to ask, and often they won't even bother to call us because they know all we'll say is call 999 if it sounds like heart pain. Of course it is. So they've saved time by using their initiative and not going to us and going straight to A&E. And generally that is exactly the right thing we want them to do. So we are encouraging and supporting training of frontline staff. Really, really important. Gareth, I'm going to pass this one over to you. Eleanor mentioned this. Eleanor said, in my experience, appointments are more difficult to obtain if one cannot use the telephone. And some of her written communications have been completely misinterpreted, with the result that I did not get what I intended. I presume that is probably through an e-consult. So Gareth, can you comment on that?
Yeah, so certainly the current ways of accessing surgeries since the pandemic began have been telephone calls, e-consults, people sending emails in, and not whilst the pandemic was at its heat, because we had to be very careful about who came into surgeries and know people were coming beforehand. But certainly doors are open. People can, of course, make appointments at the front desk. I think it's really hard because the demand that we are currently seeing is 40% above what we've ever seen before. And the way that is impounding on our phone systems is the number of lines available, the number of receptionists available to answer calls. People are really struggling to get the calls done. So e-consults can in some situations be perfect. They're a way of sending some information into the surgery, and certainly we've had patients, for example, using them. I'm trying to phone the surgery, I can't get through. Please can someone call me to organise my blood test? Which there are points through the day clearly where things are busier than others. And for that particular situation, using an email consult or an email is perfect. Yes, of course, it is very hard when comparing the written word with talking, or even face-to-face, where there's a back and forth, where you get to see people's body language, facial expressions. There is no replacement for face-to-face appointments in several situations. And as I said, there really is a need for face-to-face appointments to continue. They have been happening. Whilst we are doing all the phone calls and email things, we can't sometimes get to do the face-to-face stuff. It's a really difficult balance. I believe there is to thankfully be some further investment in our phone systems to try and help them be better, to do them over the internet, such that means patient phones at home, but it goes through the internet rather than over phone lines. It'll increase the number of lines that we have coming in, but of course, as I said, we still have to have people available to answer the phone at the other end, which I think goes a little bit to why please be nice to receptionists. They're having a horrible time. They're having a really horrible job. People are phoning up and they're just verbally destroying them. They really are trying to do their best. And starting a phone call with, I've been trying to get through for 2 hours. I know it's frustrating, but it's not their fault.
Yeah.
Unfortunately, coronavirus is what it is, and it has had some consequences.
I think it's quite nice to have this comment. What I don't want to leave the forum on a negative note. So I think we know about and actually I sort of was not sure if I should say, but it is really, really hard hitting. It's not unusual for me now to leave surgery and one of my receptionists has been in tears. That is not appropriate. So I think, let's not dwell on that. We know there's a problem. So let's move on. So thank you, Gareth, for that. So David Muir, you asked whether we've been involved with the hate crime video from Wokingham. The answer's no. And I'm wondering if you have a link that you can share with everybody in the chat box. That would be useful. No, we haven't been party to that. That'll be good, thank you. And I've got a couple of questions now about vaccines, which are, Gareth, probably over to you again. First of all, are vaccines actually available? We've heard
so
there's none around.
No, so there's a wealth of Pfizer COVID vaccine available. All booster jabs are to be Pfizer. There may well be some Moderna vaccine coming along for those who can't have Pfizer. But no, there's no supply issues on that. There has been a delay in flu. It has been said to be because of logistics and HGV drivers, for example, not being able to get them from manufacturers to wholesalers to communities. The flow of that has now improved. Flu jabs are available from local pharmacies. People are having them occupationally at work, and they're available from GP services. And yes, they're a little bit slow, but it is believed within the next 2 weeks we'll be back where we should be.
Great, okay. And I suppose actually, if it goes anything like last year, the uptake of flu will be unusually high for obvious reasons, and it's amazing. I remember doing a flu clinic last year, and I was surprised who called out the woodwork. And I thought, wow, I've known you for 20 years, you've never come for a flu vaccine. And of course, now everyone's coming forward. So particularly under 60s, and that links into what Louise from Health Watch Surrey was commenting, that her local pharmacy has running out of the under 60 vaccine. And I wonder if that's simply because unexpected high uptake, but reassuring to know from Gareth that they are coming back in the system. So I suppose it's hang on in there. We are relatively early in the season yet. I'm just doing my first flu clinic this Saturday, which is a little bit earlier than usual. So there's still plenty of time to go. So you know, we can look at that. And I've got one more question from Ian again. Ian says, I really think the person responsible for triage should be an appropriate health professional, not a receptionist. Good point. I mean, yes, yes, there will always be some circumstances where it will be appropriate to escalate up to a healthcare professional. And just to reassure you, we also have to use the appropriate resource correctly. And if a healthcare professional was continually triaging, then we have a limited time. And of course, that will impact on our ability to actually see the face-to-face appointments that we need to be doing, do the e-consult. So we have to use every resource appropriately that we have been given in the practice. And of course, that comes with the appropriate training and supervision. So yes, there will always be a time when a healthcare professional will need to be there at the gatekeeper. And as I say, often when I'm duty doctor at the surgery, I will get a phone call saying, I've got this patient on the phone, what shall I do, doctor? Absolutely fine, no problem, we welcome that. But most of the time we do support receptionists in actually doing that really critical gatekeeping role, which, you know, the amount of phone calls that come through, they are well experienced. Oh, another one has just come through. Has anyone considered using private driver volunteers to carry vaccines? They are lightweight, not bulky, and some do not need seriously refrigerated carriage. Yeah, Gareth.
Yeah, so we all tried that when we got our little phone calls telling us our flu jabs weren't coming. The manufacturers weren't happy about it. It was about the supply chain and the logistics of cold storage. So yeah, we tried, but it wasn't going to happen.
Okay, Kaylee, any more questions to fire through? I don't think I can see any.
No, I think it's just hers.
No, I think we're okay.
No, I think that's it.
Wonderful. Okay. All right. So thank you very much, everybody, for your input and your time. It's always great to see so many people. And what's really good is I often see a lot of the same names and faces. That's really good. Thank you for your ongoing support. We really do appreciate it and value it. Kaylee, is there a slide at the end which you can share, which has the website that people can send ideas through for future agenda items? Because yeah. My screen is of everybody. Oh, there we go. Ah, there we go. So that's the website. So if you do have any ideas for any future agenda items or any comments you'd like to pass to us that you may think about after the event, that's the website. Thank you so much once again. The slide deck and any links to any videos will be sent out to you. Kaylee's promised to do that. And as I say, we're all going to be here now for the next 5-10 minutes or so. So please do hang around if you want to have a chat with us offline. It'd be lovely to talk to you. And thank you again so much, and see you again. Thank you.
Bye, everyone.
Bye. Thank
you.
Thank you.